Today we'll be talking about ankle-brachial index, also known as ABI. And ABI is done on a patient complaining of claudication, patient with possible toe ulcer, patient with thigh, calf claudication, buttock claudication. So what is an ABI? An ABI is pretty much getting blood pressure in both arms, okay, and also both legs, okay. So a patient with a brachial pressure on the right arm of 130, okay, and a brachial pressure of 140 with a right ankle pressure, for example, of a posterior tibial artery of 140 and a posterior tibial artery of 130. You would be using the highest ankle pressure, which is 140, divided by the highest brachial pressure of 140 to get an ABI of 1. So 140 divided by 140, you get 1. A normal brachial pressure is greater than 1. A brachial pressure of greater than 1.3, patient possibly is a diabetic patient with non-compressible vessels, calcified arteries. So you would have a brachial pressure of greater than 1.3. So today I have a young lady here. We're going to start with, for the sake of time, just the left arm pressure. And I'm going to do the same thing with her left ankle, okay? So you wrap the cuff in the arm, okay? And I have my continuous wave Doppler here. I'm going to start with a brachial pressure. I'm going to inflate the cuff until the pressure totally disappears. So if it disappears at 160, I'm going to inflate till about 190, and I'm going to slowly deflate. The first pulse, which was at 130, is her brachial pressure. So I'm going to inflate until I can hear the pulse. And once I inflate till the pulse disappear, I'm going to slowly deflate until I get the first pulse, okay? So we have a left brachial pressure there of 130. I'm going to repeat the same thing in our left ankle. I'm going to take that, I'm going to wrap it nice and snug, not too tight, but okay. I'm going to start with a dorsalis pedis. Usually you want to look at the big toe and the index, and you want to slowly follow that down, okay? And usually you should run into your dorsalis pedis artery, okay? Inflated. It went up at about 160. I'm going to slowly deflate. And the first pulse there is 150. I'm going to do the same thing with the posterior tips. Okay, you want to look at that bone right there, and you want to kind of follow that artery, try to look for it right around the bone. You can hear it again. I'm going to inflate. Again, it stopped at about 170. I'm going to slowly increase it to about 200 and slowly start to deflate. And that's it at about 150. So in this case, you have a brachial pressure of 130 and the highest ankle pressure of 150. So you're going to divide 150 divided by your brachial pressure, the highest of your brachial pressure, which in her case was 130, and you will have an ankle brachial pressure of greater than 1, which in her case is a normal pressure. When you have an ABI of 0.9 or less, that is abnormal. Okay, so at that time, you're going to go ahead and duplex the leg, and you can see also how to duplex an arterial leg duplex on one of my videos. You want to make sure you look at the arteries down the leg all the way from the groin to look for that stenosis. When you don't see the stenosis in the leg, then you might want to consider going higher up, which could be in the common iliac artery. Thank you so much for watching the video. If you would like any further readings on what we did today, feel free to pick up my book on Amazon, Vascular Technology Made Simple. And it's also available on Kindle. Thank you.